Before asking what your erythrocytes look like, you might ask, how many of them do I have? Good question. On a CBC, the red blood cell count is usually a fixed number of red blood cells per some volume of blood, like a deciliter or picoliter. That is unhelpful to me, especially without a reference range, because I don't know how many of anything should be in a picoliter. I mean, that's a really small amount. That's a really small volume. But the crit can give you an idea of what percentage of your whole blood is erythrocytes. Crit is actually a measurement of all of your formed elements, and people sometimes forget this definition that crit is a count of erythrocytes, leukocytes, and platelets. But I mean, look at the Buffy coat. It's so small, and that layer of erythrocytes is so big. You can use crit as an indicator of how many red blood cells you have. Know that crit is like a percentage in your whole blood. So you might immediately think, oh, if I'm anemic, I have a low crit. That's not always true. If your patient has had anemia for a short period of time, that might be true. But let's say that your patient's been suffering from anemia for like months without care. There would have been enough time for the bone marrow to try really hard to compensate the anemia by making more red blood cells. But as we're learning, of course, this doesn't help. In fact, this just makes things worse because each red blood cell is deficient. And so the red bone marrow has to actually make more of those crappy little red blood cells to try to compensate. And then that creates issues with the viscosity of the whole blood. Red blood cells have this biconcave shape, which you see the picture over here on the bottom left. This picture up top is if we were to take something like a frontal cut through that red blood cell. The shape, the biconcave shape, it does two things. Two things. It maximizes volume, right? So number one, we're getting the most amount of hemoglobin that we could possibly get. But it also maximizes the surface area to volume ratio. On a CBC, the volume is measured as MCV, and this means mean corpuscular volume. Corpuscular is a fancy name for cell. That fancy name just means the average volume of a red blood cell, so about how big your red blood cells are. And you might think that the MCV should be really high, that more is better, but that's not true. There's an upper limit. There's an optimal volume to this shape. So if you're too big or too small, that's bad. Red blood cells, they don't have any organelles. They exocytosed them or threw them up long time ago so that they could fit in more oxygen binding hemoglobin. So with no nucleus, with no way to make proteins, erythrocytes have no way to repair themselves, right? And as they circulate, they suffer abrasion as they bend to fit through the capillaries. They bump against each other and everything that lines your blood vessels. And after about 120 days of this torture, an erythrocyte says, I'm out, and goes to the spleen or the liver where it can be broken down and recycled. I'm sorry, I have some alternative shapes here. This is what is called a Burr cell. This is what is called a sickled red blood cell. And this is what is called a oval cyte. This one here is called a reticulocyte. And it's not a bad thing. Reticulocytes are just like immature red blood cells. They're floating in your blood. They're not mal-shaped, but they're just like, I'm not ready yet. The volume, as I said, is limited by the available amount of surface area to that biconcave shape. So the ratio of surface area to volume, it needs to be maximized. The bioconcave shape does that, and by doing that, it allows for fast pickup and fast drop off of oxygen. This kitty, or any animal actually, provides a little bit of analogy. Let's make some fractions for hot kitty or cold kitty. Let's assume that this change in temperature from hot to cold is happening in one day, like maybe even in a few hours. So it's been a really hot afternoon, but in the evening and night, it's significantly colder. All right, so in a day, my cat does not gain or lose any volume. She's the same size. She's not growing or shrinking. She's the same volume from afternoon or night. It doesn't matter what shape you put her in, she's the same volume. But when she's all stretched out, she has a really high surface area to volume ratio because her surface area is really high. When she's all curled up, she has a really low surface area to volume ratio. And these ratios determine her ability to exchange heat with her surroundings. Right? So when she's really hot and stretched out, she has a lot of surface over which she can exchange heat with her surroundings. But when she's all curled up in a ball, there's not much area that she can exchange heat, right? So this surface area to volume ratio on this little kitty here is analogous to the surface area to volume ratio of a red blood cell. It has an optimum. So I'm not going to deny you the fact that you might be curious about how many red blood cells you have in circulation. But I mean, the number you have doesn't make a difference. They could all be crappily formed red blood cells, right? So you could have a ton of them, but that doesn't mean that you don't have shortness of breath and some other symptoms of anemia, right? So what is the quality of your red blood cells? Are they biconcave? Are they macrocytic? Are they ovocytic? We can tell these things by the mean corpuscular volume, but we can also tell these by taking what's called a blood smear, which is simply just taking blood, smearing it on a glass slide, and looking at it under the microscope. Which of these items in this chart represent your patient's blood? Right? Just as you would take blood pressure and heart rate, you need to also look at the red blood cells too. You can compare the size of red blood cells, right? Calling them microcytic or macrocytic. You could compare the shape of red blood cells from that perfect bioconcave shape to a Burr cell or a helmet cell. You could also compare the color of red blood cells, or if they have a really lightly colored center to them, or if they're pink or a more darkly colored red. You know, observing red blood cells is very similar to just observing your patient. Are they cyanotic? Are they blue? Do they have pallor, whiteness, right? Are they breathing heavily, right? Those are signs, and so are these. These are just microscopic signs.